It's another day with the physicians where your health is our business.
The growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what
You're welcome back to the training of your regular program.
Or cancer of the endometrium of the womb because of the exposure to estrogen, then you might advise
Cerebral palsy is a disorder of movement, muscle tone, or posture due to injury to a developing brain. Signs and symptoms vary with children over time, and these include exaggerated reflexes, floppy or rigid limbs, and involuntary movements. Sometimes, babies with cerebral palsy do not roll over, sit, crawl, or walk as early as older children of their age. Globally, 1 to 4 out of 1,000 live births to experience cerebral palsy, and this varies from countries to country. We will be discussing cerebral palsy, symptoms, causes, types, and treatment with our expert today on your favorite health TV talk show, The Physicians. Welcome. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course, with my favorite co-host,
Dr. Martina Agberie. Welcome to the Physicians, where your health is our
business. Dr. Martina, you look gorgeous, red and blue.
Oh, thank you. I have to celebrate every day, Memuna. Staying alive is enough to celebrate in this pandemic.
Let me help you, because truly, celebration is on a daily basis. There's nothing like I want to wear shoe for one occasion.
In fact,
staying alive is an occasion.
I'm even making it more deliberate
and intentional, right?
Surviving the coronavirus.
All right.
I actually had it. I survived it. It wasn't a pleasant experience.
Let's not go there. This survival mood, that's where we are now.
All of us. Remind you again. You remember that during the peak of the pandemic, all that you treasured was just your 90?
That's it. Moving up and down.
Yes, you'll be able to wear
anything. Yeah, you're right.
So why not now?
We are alive and well, fully vaccinated with the booster dose. I got you. We have an important topic today.
Cerebral palsy.
And it's kind of, when you hear 1 to 4 out of 1,000 live births to have, that is high. And these are kids that some of them can't even roll, they can't crawl, they can't. So you can imagine the burden. Do you have anyone that's been a physician? Please.
Being a physician, I've seen a couple of children, and the most traumatic aspect is the parents. Like the
mothers especially.
And the mothers, they are always the burden bearers.
Yeah.
Okay.
And the nurturers.
So and they will ask, why me?
Is it what I ate?
Is it what I ate? Did I do something?
Is someone from the village after me?
Someone said she thinks that because she crossed a particular person's path that morning, that was what was. And the woman said, you will see.
So that statement, she heard,
she believes that.
So why you cannot even be saying anything, because the truth is that maybe that was just, you will see. Yeah, and then she held on because she's not looking for a reason why she's having a child with cerebral palsy.
For a coping technique.
So being in that space, we keep her grounded. That after it wasn't my fault, it was somebody that told me, you will see.
But then I still think that if you hold on to such a thing, you are doing more
damage, harm to yourself. And that's why I truly love today's discussion, because having an expert to come, demystify the myths, and letting us know the facts, and also educating our audience what cerebral palsy is all about. Not that one that because you have a child with cerebral palsy, you will go and drop the child at the bank of the river so that the child will turn into a python and go away. Yes. We've had so many of those, so it's good that when she comes in,
simply something has to do with
the brain. So we'll be right back after this short break. Do stay with us. Welcome back. If you're just joining us, this is The Physicians, where your health is our business. On today's show, we're talking about a very important and salient health challenge that we do see from time to time, and sometimes even in villages is being seen as a taboo, is being seen as, those children are being seen as outcasts, and we are narrowing it down to what we call cerebral palsy. To the layman, this is a disorder or a disease of the brain. And with us today, we have a lovely, dynamic, very cerebral, young pediatrician, and she's no other person than Dr. Zainab Opoola. She's a consultant pediatrician and runs the Pediatric Neurology and Neurodevelopmental Clinic of the world-renowned MASSEY Children's Hospital. Dr. Zainab, you're welcome.
Thank you very much.
Nice having you on our program.
Thank you very much.
Looking dynamic, young, and
Thank you.
We'd love to see them, because the truth is that those children are part of our constituency. I don't know about Dr.
I'm actually excited seeing Dr. Zainab here because she's young. Like you are actually still in Nigeria.
Yes. That is a topic for another day. We will talk about the Japa syndrome. But for today, we admire and thank Dr. Zainab for coming. Dr. Zainab, the audience are like, what are these three doctors? Cerebral palsy. This one, is it not too big of an English? Please, can you break it down so that our audience will understand what is this cerebral palsy all about?
Okay, thank you. Thank you very much. Well, cerebral palsy can be described, like you said in the introduction, as a disorder of muscle tone, posture, and movements. And this usually occurs due to an injury to a brain that is developing. So a child is not born with cerebral palsy. What happens is over time, as the child is growing, especially in the first few years of life, if there's an injury to that brain, the child can now therefore present with cerebral palsy. So this injury can happen in utero while the child is in the womb. The injury can happen during the process of delivering the child, or the injury can happen even after birth in the first few years of life when the brain is actively developing. So that is like a summary or an overview of cerebral palsy.
Okay, so just talk about cerebral palsy being an injury to a developing brain, okay, which can happen during in utero, at the point of delivery, and after delivery. What are the possible causes of this? What can happen inside the uterus that can make it cause an injury to the brain during the birth, the delivery, and after? What are the possible causes?
Thank you, Dr. Martina. So, in the womb, in utero. So, in utero means when you are still pregnant for the child. In the first trimester, if the child is not properly formed, the child can have some genetic abnormalities. The child can have some brain malformation. Maybe the brain was not formed properly. Or the child can acquire even infections while in the womb. So there are some congenital infections that people have, like congenital rubella, you know, if you have syphilis, a child having syphilis, a baby, a newborn. So those congenital infections can make those children have cerebral palsy later. So those are some of the examples of before delivery. So at the point of delivery, the commonest cause of cerebral palsy is a perinatal asphyxia. I'm going to try to explain that. Yes. So perinatal asphyxia, in simple terms, it just means oxygen not getting to the brain in the first minute of life. So in the first minute of life, oxygen, the child is supposed to come out, cry, and the lungs will expand and take oxygen around to the body and to the brain. And the brain must receive it in the first minute. We call it the golden minute of life. So that, if that process is disturbed, it can lead to what we call asphyxia, and that will lead to subsequent brain damage. So that is a common cause we are seeing in our environment, because, you know, some of these deliveries are not taken in proper health center hospitals. Some are taken in traditional birth attendants. Some are taken at home. I know some are taken in churches too. But if a church can have a doctor and a midwife, that can, even a pediatrician, so that in case those deliveries are complicated, somebody is there to actively resuscitate the babies. Or better still, if it's getting to a complicated delivery, you refer to the appropriate channel. So that is at birth. Then after birth, another common cause is neonatal jaundice. So neonatal jaundice is a common condition in newborns. You know, that's yellowness of the eyes and the skin. It's very common, and majority are actually harmless, to be honest. But at what point will you know the harmful one?
Exactly.
You know, so because once the value is very high enough, once the jaundice level is very high and it crosses into the brain, it can cause a brain damage, which would eventually predispose the child to having cerebral palsy in future. Other causes post-delivery, that is in a newborn, are infections. So if the infection is so much that it spreads to the brain, causes meningitis, that is a possible cause of cerebral palsy. You know, so those are the common causes post-delivery of cerebral palsy. And the truth is that the only cause that we can prevent is the in utero cause. That is, not even all, some are preventable with proper antenatal and all that, but maybe for malformation, right? You can't be God to create, you don't know how to create, but the infections are preventable. The delivery process, those ones are preventable. And post-delivery, because these children are born apparently healthy, but they got an infection that was poorly treated and eventually develop cerebral palsy. So it's actually something that is quite preventable.
I like the way we are breaking it down for people to get the full grasp of, you know, things that can happen while you are still pregnant, things that can happen at that point where you are having that baby, and then afterwards, so that people will know where, you know, they need to really put all the emphasis. And all these three stages, emphasis are 100%, because you never can tell where it is. So now that we know what can cause this, what are we supposed to see? What are these signs and symptoms that people can see and say, I think my baby cried immediately after birth. My baby didn't fall ill. He didn't have jaundice. But I heard one time they said if my child is experiencing this, it means I need to do. So it's good that we get to know what are the things we need to look after.
So the common telltale signs, or the common signs, are what we describe as delayed developmental milestones.
Okay.
So
how does that work? Because people say, what is the developmental milestones?
So delayed developmental milestones are those skills or those things that the child should actually acquire at particular ages. Okay. So the first thing is the neck control. So the neck control, by 3 months, 4 months, 3 to 4 months, a child should be able to lift the head, hold the neck well. So when a child still has lagging, the neck is still lagging, you should be suspecting that something is wrong somewhere. So when you proceed, you know, that's the first milestone. The next thing, the child is supposed to start sitting. The child is not sitting as at when due. So by 8 months, 9 months, your child is still not sitting. You should start getting worried and you should start seeking for help. If you also notice your child prefers to use one hand, you just know, I reach out to something and my child just likes a particular hand preference. He doesn't like to lift the other hand, doesn't like to play with the other hand. You should know there's something wrong. Something is wrong somewhere. So those are some of it. Even crawling, you know. So those are the things the parents might pick. Going to the health professional, the doctors will notice there's stiffness. Even some parents will notice it, that, oh, doctor is like, this hand is stiff, you know. So that's increased muscle tone. So there's stiffness of a particular limb, or either upper limb or lower limb.
Not the one that the child usually uses more often?
Yeah, so the stiff hand is usually the one the child doesn't use more often.
Oh, because it's not stretchy. It's the other one that...
So that's what explains the preference of a particular hand. Some children tiptoes, they tiptoe. So walking on toes, but not all tiptoeings are attributed to cerebral palsy, but that's also a sign.
Any particular reason for that?
It's because of the tone. So the tone in their legs are increased. So it's not easy for them to stretch it. So the tone, so it's because of the increased tone. So that's why they tiptoe. So those are some of the early signs, especially in the infant years.
So this like this body movement thing, because you said it affects movement, tone, and is it the whole body or the particular part of the body that cerebral palsy, we see that in children or not?
Okay, so it depends on the extent.
Okay, your damage,
yes,
okay, our affectation.
Yes, because cerebral palsy, sometimes you can see people with cerebral palsy that walk. They walk, but they might have just a little limp. So that is not so bad. Just a little. That's cerebral palsy, because most times cerebral palsy doesn't affect the intellect. Sometimes it does. So you can see a person with cerebral palsy that has a limp. You know, it's disorder of posture, movement. So once that limp is already there, it's cerebral palsy. But there are some severe types of cerebral palsy that can affect both lower limbs. So it can affect both lower limbs, and those kind of children can have it difficult to walk.
I think it depends on the degree of the impact.
It depends on
so are there like stages of cerebral palsy, like stage 1 or degrees?
Yes, there are more of types.
Okay.
And topography, or the kind of which parts of the body it affects. So there are types, that's whether it's a rigid type of cerebral palsy, because another type I've not really even explained is the floppy type. So there are some...
Dr. Zainab, you know what? It's good that we are getting into the depth of this, because that types is what because people are like going to be wondering, types, okay, now I need to know whether my child is having this or my child's neighbor is having this. We'll be right back after this time out. Let's go out with keeping up with the physicians and hear what you have to say about cerebral palsy.
Yeah, I think this should be abnormal brain development or damage to the brain when it is still developing. If they can be cared for at a young age and assisted from young age, I think they can go on to develop into and have a normal adulthood.
Welcome back. We have been discussing cerebral palsy with our consultant pediatrician, and she's schooling us on what really cerebral palsy is all about. You've heard about the fact that it's a disorder of posture and movement, and if you have a child that's supposed to have attained neck control by 3 to 4 months and that child hasn't done that, it may mean the child may have cerebral palsy. But while at that, Dr. Zainab was telling us about the types of cerebral palsy. So Zainab, can we go from there?
Yes, thank you very much. So the types, the terminologies might be a bit medical, but I'll try to break them as simple as possible.
Not a problem.
So we have what we call the spastic type of cerebral palsy. So that is usually the most common type, because in this type they are usually stiff.
Okay.
You know, the hand or whatever part that is affected is usually stiff. Then we also have what we call the dyskinetic type of cerebral palsy. So the dyskinesia, they are usually always moving. you know. So because it's a disorder of tone and posture, movement, you know, your hand is supposed to be still like this, and you're moving, you know, you can't really stay still, you're moving and all that. So we also have what we call the atonic type. Those ones are usually very floppy, and also those are some types of cerebral palsy. Then depending on the affectation of the limbs, you know, so you can have affectation of one limb, you know, that's called hemiplegia. So as one limb, yes. You can have the affectation of both lower limbs. So that we call that paraplegia. You understand? And if sometimes it affects the whole 4 limbs. Yes, those kind of children are usually on the wheelchair. They can't even use the upper extremities, you know. So that is quite very severe, and that we call that quadriplegia. So it depends. So they are classified based on the type, the characteristic, or the affectation of the limbs. So those are some of the classifications.
Okay, so we've talked about the different classifications, the types, talked about the floppy and all those ones there. And you remember you also mentioned the possible causes, in utero, at the point of delivery, and post-delivery. Please, how do you manage these people? Okay.
Well, management is usually multidisciplinary. It's not the doctors alone can't do it. We need a whole lot of experts in managing them, because they'll require, even from counseling to physiotherapy and all that. So I'll try to list out some of the teams that are involved in management and the roles they play. So we as doctors, we make the diagnosis, we try to educate the mom on the possible cause, why it happened, you know, and we try to coordinate the care. We as the pediatricians, we do the coordination of care. So they'll also need to see a physiotherapist. The physiotherapist will help in the exercises of those limbs. The physiotherapist is a major key stakeholder in the management of this condition. They'll also plan to see the ENT surgeons, because some of them, depending on the cause, there might have been affectation of the hearing, and that will affect talking too. So we try to make sure hearing impairment is not associated, in case they need implants and all that. Some of them, nutritionists, we need to see the nutritionist, because it's a disorder of muscle tone, posture. Muscles are involved in swallowing, you know, so they might have challenges swallowing food. That's why you see most of them, some of them, as they grow older, they drool. So the drooling is because they can't swallow easily. So they might need the nutritionist to help with feeding and all that. They might also need to see the orthopedic surgeons. So because depending on the degree of severity of those spasticity, they might need to release some tendons and all that. They might need some surgical procedures to help them with that. Sometimes we also refer them to the ophthalmologist, because there can be affectations of eye. Some of them have these like squints, so we might need to see. So it's a multidisciplinary approach. They also need to see the occupational therapist, because most of the muscle we are describing are the large muscles, sometimes fine muscles, even just to hold a pencil, you know. It might be difficult. So the occupational therapist will help with those fine motor skills. So those are some of them, while we coordinate this care and go for follow-up and all that, because in as much as they have this disability, we want them to live a life,
quality life.
Yes, we want them to attain a function that they can, you know, because if we start, and treatment is early, I must not forget that early treatment is key. The earlier you intervene, the better the outcome. So we need to intervene as early as possible, with all these people helping us, and we'll try to get the best for that child as possible.
So this means that, you know, living in denial is detrimental to the future, the outcome for this child. So are there complications, and what are the prognosis? Like, you know, when we talk about, as doctors, prognosis meaning the outcome at the end of the day, and what are the complications we should be
so it depends. So I'll start with complication. It depends on the degree of severity, really, because some of the complications are malnutrition.
Because they are not eating well, and if they are negligent about the child,
and malnutrition can predispose them to infections, you know, and all that. And if they are not mobile and they are just in one place, they can have sores, bed sores, you know. They can have what we call contractures, because they are so stiff And you know, when you're not having physical therapy regular, so they are just stiff like that, and it's contracture. And those are some of the common complications. And they can have associations.
Okay.
So a child with cerebral palsy can have what? Epilepsy with it.
Seriously?
Yes.
Because of the brain damage.
Exactly. So those are associations. So, and that needs to be treated with medications. Even the spasticity and stiffness, there are medications we give to treat them. There are surgery. If people that can afford it can have Botox injections to help to release those stiff muscles. So then the prognosis also depends on the degree of severity. Like I said, there are doctors and there are lawyers with cerebral palsy. There's a lawyer that has cerebral. There are people that go to university with cerebral palsy, and there are also some other sets of children that are wheelchair bound, even with the best of care in the best centers in the world. So it depends on the degree of severity. So the prognosis now depends on the degree of severity and how early intervention was. So I can't really give, most children with cerebral palsy are this. It depends on those
care is important. Also, Dr. Zainab, this has been so amazing. I'm as enlightened, and I'm sure our audience right there, they are also like taking notes and keeping it up with us here at the Physicians. Thank you very much, Dr. Zainab. You've heard it, right? This cerebral palsy is not witchcraft. Nobody is doing you. The child has already developed a complication doesn't mean that, it's an outcast. It is preventable. From what you've heard her say today, it's preventable, because this can happen while the baby is in the tummy, right in your womb, and during delivery and after delivery. But there are certain things that we should take cognizance of. Attend antenatal early. The earlier, the better. Health education, this is what we are doing now. But of course, if for any reason, because we all know in science, there are still some rare cases, there are still some occasions where this will still happen, despite you've done so many things. But if you notice, your child is supposed to have developed or achieved a certain milestone at a particular stage, month, and he or she hasn't, then that means there's a reason for you to get help, and help on time, which is intervention, is always better. Thank you very much. My name remains Dr. Memuna Yusuf Kadri.
And of course, always remember to keep a date with the Physicians, where your health is our business. One thing that is very, very important that you have to do for children that have cerebral palsy, they need support, family support, community support. Do not relegate them to the background. They need love, they need care. Stay tuned till next time. Keep a day with the Physicians, where your health is our business. And remember to always follow us on our social media handles. If you want to be part of this program, just a click away. Just send us an email. I'll be right with you. Stay tuned. Till next time, I'm Dr. Martina Agberi.
Keep watching the Physicians. You will be intrigued at the kind of information you hear all the time.
So well, and all our excuse was you have A's in your subjects. So, and I'm like, okay, no child will go through this. So I